Plastic surgery is the umbrella term. Reconstructive surgery is one part of it. Cosmetic surgery is one part of it.
Okay.
To convert something from subnormal to normal is reconstruction.
Okay.
And to convert something from normal to supranormal is cosmetic. Liposuction is basically sculpting the body. I won't say it is removal of fat. And in males, gynecomastia has become very common. Cosmetic surgery, by the way, it's largely, I always say it doesn't exist in a cultural vacuum. What I mean is that culture affects your need of cosmetic surgery, your appreciation of cosmetic surgery, and the way you take that whole procedure, how you respond to it. So, my tagline is surgery for the soul.
Surgery for the soul.
It's not surgery for the body, it's surgery for the soul. We operate on the body, but the surgery
is for the soul. Hello everyone and welcome to today's episode of The Health Talk with Dr. Sagorika Mullick. In a world where filters can transform appearances with a swipe and social media constantly redefines beauty standards, today's conversation about cosmetic surgery has never been more relevant or complex. With us today is my dear friend Dr. Kiran Naik, a distinguished plastic surgeon who will share with us how his 3-decade journey in cosmetic surgery has given him a unique perspective on how our relationship with beauty has evolved. Dr. Kiran Naik is a plastic surgeon with more than 20 years of experience and more than 2,000 procedures under his belt. He has completed his medical education, including MCH in plastic surgery, from Grant Medical College and Sir JJ Group of Hospitals in Mumbai. His primary field of work is in cosmetic and aesthetic surgery, but he also considers it his duty to perform reconstructive procedures on a social basis at charitable costs and in remote rural areas. He believes that beauty is not just an appearance but an attitude, and happiness and beauty comes from loving oneself. So, he considers it a privilege to help people find happiness by giving them the appearance and body image they desire. I believe that's why his clinic is called The Beauty Doctors. Welcome Kiran to the Health Talk.
Hi Sagorika.
Hi.
Very happy to be here with you.
Thank you.
It's such a nice thing to
Right. So Kiran, you have done your super specialty in plastic and cosmetic surgery, right?
Correct.
But in our medical field, we have got some 3 different terms. Like, one is a reconstructive surgery, one is plastic surgery, and one is cosmetic surgery.
Yes.
Are they all same or they're different?
So, plastic surgery is the umbrella term.
Okay.
It encompasses all the other things. Reconstructive surgery is one part of it. Cosmetic surgery is one part of it.
Okay.
And if you want to know the difference, so in plastic, what we say is to convert something from subnormal to normal is reconstruction.
Okay.
And to convert something from normal to supranormal is cosmetic. So, matlab, if there is a loss of function,
right?
So loss of function could be anything,
right?
तुम जल गए हो, मार लगा है, तुम्हारा कैंसर सर्जरी हो गया है,
right?
They have removed something from birth. There is some deformity,
right?
जिसको correct करना. So these are all mostly functional problems.
Right.
उससे तुम्हारे function में, your living में there are problems. There could be a huge wound.
Right.
So when we are doing this, trying to repair all this, it is reconstruction.
Right.
Cosmetic surgery, there is no deformity whatsoever.
Right.
There is nothing wrong.
Absolutely.
Everything is going along absolutely fine. No body part is affected.
Right.
And still you want to enhance it.
Right. So that is cosmetic.
Without any problem, without any defect, without any deformity, you still want some part of your body shape, size, enhanced, reduced, some change.
Right.
Then it becomes cosmetic surgery.
And so all these years you have been practicing cosmetic surgery.
I am. So what happens is, when nowadays this is the age of specialization.
Right.
Everybody अभी for example कोई सिर्फ कंप्यूटर साइंस करके नहीं बैठता है, फिर आर्टिफिशियल इंटेलिजेंस करता है, कोई डेटा करता है, थिंग्स लाइक दैट.
Absolutely.
Niche topics.
Right.
So similarly, now there are some surgeons, plastic surgeons, who will focus on only reconstruction. In fact, now to within reconstruction, there will be plastic surgeons who do only hand surgery.
Right.
There will be some who will cover only oncosurgery, means defects created by cancer. So similarly, I am doing only the cosmetic part.
Right.
Because what happens is when you do more and more of something less and less,
Right.
you become much better at
Obviously.
giving better results.
Obviously. Super and super specialist.
So
Right.
we are specializing in a smaller and smaller field so that we can give better and better
results. Absolutely. So what are the most common cosmetic surgeries you do in your day-to-day surgery?
Commonest is definitely liposuction. After that, liposuction is basically sculpting the body. I won't say it is removal of fat.
Okay.
Removal of fat is a way to achieve a certain result.
Right.
And liposuction the result that we want is a better shape of the body. So liposuction is that. So whenever you have a certain fat bulge somewhere, we can, bring it down to a better shape.
Right.
So that is liposuction. Other common surgeries are tummy tucks, breast surgeries.
Okay.
Number of breast surgeries we do. And in males, gynecomastia has become very common. Gynecomastia means when a male has slightly prominent or sometimes very prominent chest pe jo breast hai, that becomes heavy or it's bigger than. Aajkal everybody is gymming, they are young boys and they are wearing very nice fitting shirts, rippling muscles.
Right.
तो वो थोड़ा टी-शर्ट में अच्छा नहीं लगता
है, right? So they don't want it there.
They don't want it. So that because of this is one of the things which happens when society starts doing its changes. So this gynecomastia has come up very commonly. Hair transplants is very common.
Right.
So the point is that males have become more and more conscious of their looks and become more and more vain. Earlier we used to think of women being vain, but believe me, men are
equally vain.
More vain.
More vain.
More vain than men.
Right.
So these are the common surgeries that we do.
So before a person decides for going for a cosmetic surgery, do you think they should think about why they are doing it and ask those questions to themselves?
See, this is a surgery at the end of the day.
Right.
And things can go wrong. In spite of the surgeon doing his best. Fantastic surgeon, everything good, but still sometimes complications occur.
Right.
So you have to be very certain that you do need this procedure for yourself. You have to think about it, you have to understand the procedure, you have to know what complications can occur. Make a decision कि इतना chance है मैं ये risk लेने को तैयार हूँ. See, complication rates are very low. I mean, they are usually less than 1%. But still, it is a procedure which cannot be taken lightly.
Right.
You have to give it adequate thought. If you want, talk to 3 surgeons. If you want, talk to friends. You can do all that, and then only you come to a conclusion.
Right. So this is what the person should ask himself or herself.
Yes.
What questions do you ask the patient before deciding that this person is going to be the right candidate for a surgery? I mean, you also have a choice, right?
Yes, of course. It's not a choice, but it is for me to guide that person.
Right.
See, 10 patients come to me. Out of that, 5 will have certain expectations which are probably not realistic enough. That
Does social media play a part in this?
Social media, Actually, not in this. I don't think social media, because we have been having the same situation even 30 years back. When I started also, it was similar. And I know for a fact that even I was undergoing training that we used to have patients like this, and that portion has remained. See, if you have 10 patients, 5 will have unrealistic expectations. ये proportion तो same रहा है.
From
लेकिन जो expectations है वो बदल गए हैं. वो unrealistic पहले से भी थे, वो बदल गए. And not everybody has unrealistic.
Right.
Secondly, what happens is, it is my job to also tell them that this is unrealistic, but I can give you this. Is this okay with you?
Right.
If the patient feels yes, I am okay with this. I mean, वो मेरा जो once they become convinced कि अभी मुझे चाहिए, for example, I mean, you name it, ऐश्वर्या राय जैसा nose चाहिए. शायद मैं सबको तो नहीं दे सकता हूँ, but I can tell them कि तुम्हारे नोज में मैं ये चेंजेस कर सकता हूँ. Is that okay with you? And they'll say yes. Forget Aishwarya. This I am happy with this. So why not? So I have to also tell them what is possible. I have to make things more practical for them. थोड़े बहुत तो उनका expectations कभी-कभी कम करना.
Right. Cosmetic surgery, generally people believe that it is only a choice. There is no need for cosmetic surgery. What is your opinion on that?
No, I have said this number of times before to people, and I'll say it now also. To that person who is contemplating, it is a very strong need.
Okay.
It is a very strong need in the mind. Lot of us have got what we call a strong body image. What is a strong body image? A strong body image is something whereby that person has a notion, a fixed notion in their psyche कि मैंने ऐसा होना चाहिए. और जब something is interfering with that, it troubles them immensely. And ultimately, as a doctor, as a medical person, we have dedicated our lives to our professional lives to trying to make them happy and sound, not only in body but also in mind. What is the psychiatrist's role?
Right.
उसको भी अपने patient को mental relief देना है. To some extent, हमारा भी ये काम. So, for example, I'll tell you one more thing.
Okay.
Don't we accept a transgender person? What is the transgender person issue? कि मैं जब मिरर में देखता हूँ तो मुझे वो नहीं दिखता जो मुझे चाहिए.
Right.
Similarly, this cosmetic person is also looking at the same. He's looking in the mirror, she's looking in the mirror and seeing something different from what they want. And then they are strongly motivated to do something about it.
Right.
So it's not a luxury, it's a need. 110.
Right. So, as you're saying, right, it may not be a physical need because there is no loss, but it is definitely a mental need. And more than mental, I think it's more of an emotional need.
Emotional need, a psychological need.
Because they're not happy with their body.
They are not happy. It is our duty to see to it, at least try to make them happy.
Right. So, but then this need, is it generated because of the society's perception of beauty?
No, not at all. There are many people who will come and have some request which might not necessarily make them better looking. Acha. Now, for example, if it was, now I have some patients, for example, Muslim ladies. They walk into the clinic in a burqa and a niqab.
Right.
They come inside the clinic and they'll raise their neck.
Right.
They'll come inside my consulting and when I have to examine them, they'll remove the burqa.
Right.
Okay. These women are not going to be showing anything to society.
Right. Okay, that's perfectly fine.
But they still want that cosmetic surgery. There are other women who are not going to wear, clothes which are well-fitting, which will show off their bodies. There are some who will also. It's the general population. But what I'm trying to say that it is not society's perception. It is for them when they look at themselves in the mirror, for them to know that they are looking like this. So, my tagline is surgery for the soul.
Surgery for the soul.
It's not surgery for the body. It's surgery for the soul. We operate on the body, but the surgery
is for the soul. So, just to
it
make
is for themselves, entirely for themselves.
Oh, that's a nice tagline. Surgery for the soul. I loved it.
You see, age, experience, all the living experiences that you go through relationships, you go through various emotions, that teaches you a lot. And your perceptions can change, your desires can change, this body image thing can change.
Right.
So we don't want them to commit themselves to a surgery unless they really are, able to understand कि जब मैं ये कर रही हूँ या कर रहा हूँ मुझे क्या होगा. Why? Because at that age they are not really mature enough to realize the consequences. Why do we not want 20-year-olds who drink alcohol? Because at some place we feel that, maturity, living, all these things teach you. So we want to do that. But on the other side, I have operated on at least a few patients less than 18, but only because their psyche has become unka jo personality hai, that is suffering at some point. I give you an example. I had a girl who was approximately 16 or 17-year-old and she wanted a breast reduction. So I refused. First of all, I refused. But then the parents came and said, you must do it. Why? because they said that that girl is even refusing to go to her college
Right.
because she's embarrassed about it. So then,
So there the peer pressure comes in.
it's not peer pressure. It's not peer pressure. She is not going because she feels that because of the large size of her breast, she is embarrassed. She thinks that there is she is looking at
Possibly she must have been ridiculed about it.
no, even if they don't openly ridicule, this is more of that person thinking that I will be ridiculed. Whether somebody ridicules them or not is different. But at least they might feel embarrassed of it. So she was significantly affected. I sent her, I said, you talk to a psychologist and see. They also recommended an antidote. And we did the surgery. And after that, she was much happier.
Right.
Yeah, gynecomastia.
Right.
Young boy again, 17, 18. He would not go in front on the stage. He would not be able to speak well in his interviews or, groups. These are things which can affect the future of this child.
But it hurts their self-esteem or self-confidence.
Self-esteem is severely affected by this. So if the self-esteem, their confidence, their individuality is affected by all these things, then I think even the lower age limit we do reduce sometimes.
I understand that. But somehow I feel that nowadays, again, I would say thanks to the social media, the image perception of body image is changing. I need to look like this to fit into a sort of. So don't you feel that more and more younger people are coming in asking for?
There are younger people, 110%. In fact, the proportion of younger patients who come for consultation has grown significantly. But I would say they are looking more for non-surgical procedures.
Okay.
Surgeries, they are not so. Once they come also, they might say कि मेरा nose मेरे को ऐसा करके चाहिए, thinking that it's something simple. But once I explain the whole process and what it involves, they will take a step back.
Right. Because
surgical decisions, I still feel that social media can only push you, but it cannot take you over the edge.
Right, because obviously there's always risk involved, and if you're counseling the person, see, but there are many people who are not ethical enough to do so.
Yes, that is part of a society. That is part of every sphere of life.
Absolutely.
And we also, I might frankly tell you that I have come across many cases where I have been very disappointed because something has been done for the patient which I feel should not have
been done.
That has happened many times.
Yes, but if a person of a younger age goes through surgical procedures, does it increase their risk?
No.
Nothing like that.
No. The risk remains the same.
Right.
It's not that risk. It's the risk of the sequelae, and then later on they feeling let us say she does a breast augmentation at 18. By the way, I have many girls who have come asking for breast augmentation at 18.
Oh, yeah.
And I have refused them. So let us say this. And she insists and whatever, and she gets a breast augmentation done. Now, in the long term, breast augmentation the breast undergoes certain changes.
Okay.
20 years down the line, she was 18 when she did the surgery. At 35, 40, she finds certain changes, and then she is very upset because she never anticipated this and she didn't want it.
Right.
And now that need for that bigger breast thing has probably receded in the background.
Right.
And now she is regretting her decision. We don't want that to happen.
Right.
So these things she must understand, and that is the job of the plastic surgeon to tell them. Unfortunately, the competition in the cosmetic field is immense, especially in metros like Mumbai or Delhi or Bangalore. And this competition makes a lot of clinics fight hard for their profits and makes them do things which they should not.
Right.
Or sometimes you have these cosmetic clinics who really don't even know the depth of their, they don't have the knowledge.
We do read in the paper sometimes things going wrong, and then, a lot of hullabulla happens after that.
But what I have noticed is that those things which come in the papers are actually complications which can occur to anybody. It's not most of the time, because we as medical professionals, we get a judgment of what has actually happened.
Absolutely.
And those are complications which actually have happened in spite of the efforts of the doctor. It is a natural reaction of any human being that when something goes wrong, we look for somebody to blame. Actually, this is not unique to cosmetic surgery. This happens to every medical profession.
Absolutely.
I mean, recently you heard that one doctor who was treating a cancer patient got stabbed.
Yeah, stabbed.
Now, he didn't get the patient to have cancer.
Right.
He did not do anything.
Right.
And the patient's relative son thought that he is not even an educated person. How can he judge whether what treatment is correct?
Yeah, accepted, but that is exactly what I'm trying to find out. Is it that their expectations are unrealistic and because it was not communicated to them earlier?
No, I know that a lot of clinics, a lot of doctors really do not explain complications properly.
Right.
I know that for certain.
Right.
A lot of them. We get by because most of the time these complications don't happen. So one thing is many a times patients are not aware also.
Right.
Secondly, in spite of explaining also, and this I have also personally experienced.
Okay.
That we explain everything to the patient. Now, in that conversation and in their, enthusiasm or whatever, they usually do not grasp it or do not understand it. And then in case it happens, then they will be furious. Acha, when you show them documentation that I have explained this to you,
right,
they might calm down, but their feeling, the blame that they put on you still does not go away.
They still want a scapegoat.
That is what. So every human being, when something goes wrong with him or her, wants to find somebody to blame. And in medical cases, the person
to blame themselves.
Obviously not. Neither can they blame God for this.
Right.
So the first person to blame is the doctor.
Right.
So that happens.
So if somebody comes to you suppose they are not happy with whatever the outcome is as a revision, surgery, how do you handle such patients? When I do get patients sometimes who are not very happy, although fortunately for me that percentage is very, very low. But when I do get them, I would initially just try to understand what is their complaint, why they feel that they have not achieved. We always take pre-operative pictures, and because that is the only documentation, so we can actually show them that this is what we wanted to achieve and this has been achieved. Right.
Achha, in case something has not been achieved and if it is possible to help them further, we can redo some surgeries. For example, rhinoplasties, nose jobs, we have a redo rate of almost 5 to 10%. Maybe mine is, I hope, lesser because maybe I give my, I try to, bring down the expectations of the patient. So fortunately,
bring down, I think maybe more realistic, right?
This rate is reported across the world. वो सिर्फ अपने not सिर्फ मुंबई में है या इंडिया में है ऐसा नहीं है. In fact, in US, they report revision surgery rates in rhinoplasty of 20%.
20%? Right. The expectations are way too high,
It's not our expectations. I think there's a cultural thing also here. Cosmetic surgery, by the way, it's largely, I always say it doesn't exist in a cultural vacuum. What I mean is that culture affects your need of cosmetic surgery, your appreciation of cosmetic surgery, and the way you take that whole procedure, how you respond to it.
You were talking a lot about this breast augmentation or reduction of, and you said that, younger people, you generally try to avoid doing them.
Very young, yes.
Yeah.
25 and above, I will not hesitate.
Yeah. No, my question was that, does this, suppose that, as you said, 25, person may not be married, so does this later affect her breastfeeding?
No, it does not. It doesn't, it doesn't cause cancer. It doesn't do anything of that kind. It has its own set of issues.
Right.
But these are not those.
These are not. Because because younger people especially, we have to think about a little later in life, maybe childbearing will happen. So what are the, we have been talking all this time about surgical options. So what are the non-surgical options people have or in the cosmetic field?
So non-surgical, when we talk, it is largely for anti-aging.
Okay.
So in anti-aging, there is a distinct bunch of treatments which is surgical and a very distinct and far more commoner bunch of treatments which is non-surgical.
Right.
So,
Do they give similar
in
results?
fact, I am moving more and more towards in spite of being a surgeon, I am moving slowly more and more because I am getting better and better results with some non-surgical treatments.
Wow, that's great.
One thing is the demand for anti-aging procedures is going up. In fact, I think that is going to be one of the big major, cosmetic procedures to be performed shortly. And the reason for that is also the fact that the generation which is, anti-aging procedures you start asking for or needing usually after the age of around 40. Now, this is the bunch which was born, which is what we call the millennials.
You're right.
Right. And the millennials are the generation which has grown up with aspirations. They have been exposed to so many things. They are aware. They are more affording. They have more disposable incomes. They travel widely, and so millennials will be looking more and more. They're already looking for it, and they're looking for more and more anti-aging procedures. The same thing happened in the US with what is called the baby boomer generations. The baby boomers actually drove the cosmetic industry in the US, and the millennials will, I think, they're already driving.
Right.
So they are the ones driving cosmetic work here. Anti-aging procedures, the commonest that I do is Botox, I do fillers, and I do a non-surgical facelift.
Okay.
And this is giving me better and better results. And if patients come earlier and earlier enough, then I can give even better and better results.
Yeah, and if they are giving good results, then why not do that?
Absolutely.
Right.
Why?
But then Botox, it's using that toxin, right?
Yes.
So
it's a poison.
Right. So you need to be extremely careful.
No, you don't have to be.
No?
If you are qualified, if you know your stuff,
right,
then Botox is probably the safe. Given a choice, अगर मेरे को किसी ने बोला कि बाबा तेरे को कुछ ना कुछ तो करना ही है, इसमें मैं Botox choose करूँगा.
Oh, okay.
Very safe, very safe.
Okay.
Good hands.
Of course.
And
it's a very fast procedure.
Yeah. It's an office thing. You walk in, you get the Botox done. 15 minutes later, you go home. Do what you want.
And the results are seen immediately.
No, results are not. Results usually come up after a week. But one good thing about Botox is also one bad thing about it. The result lasts 4 to 5 months.
Okay.
So even if you screw up somewhere, even if things do go
wrong,
south, you are going to be fine after 4 months.
Right.
In fact, usually you are fine after 2 months only.
Okay.
But then if the results are nice also, you have to repeat it after.
So both ways it works. Right. And what about the other fillers? Like, where do you use it normally? And you said, why do these people come in for this? Is it just for...
Who wants to grow old? Nobody wants to grow old. I don't want to grow old.
Or old, yes. We may not look old, but aren't we growing old?
But if you think about it,
right.
If I'm 57,
right,
but there are enough people, I don't really care, but there will be enough people who at the age of 55 or 50 might want to look like what they were at 35, 40. Why not? I think a lot of people like that. Anti-aging is a strong, I think it's coming up very strongly.
Absolutely, why not?
So you will find that your children and my children will be looking for anti-aging solutions far more than what we did. Yeah.
I think now we should start looking for anti-aging solutions. What about, nowadays everything is, we are talking about technology, AI and all these things. How does technology play a part in cosmetic surgery?
There are different ways. One thing is, of course, the stuff that we actually use, instrumentation.
Right.
Products in the sense, for example, fillers.
Right.
Fillers, the quality of fillers and the variety of fillers it's because of technology. It's improving day by day.
Absolutely.
When we started with fillers almost 25 years back, there was one standard quality of filler and that also had its issues. Now we are having so many. So technology and science and research, like any other field, gives us quality of products that we use.
Absolutely.
That becomes better. Then, for example, we do computer imaging, especially in the case of rhinoplasty, that is nose jobs.
Right.
Patients who come for change in the shape of their nose. I always take pictures and then you have our computer programs and software whereby we can alter it to give the patient an idea of what is likely to happen. Of course, we put in a disclaimer that this is not real life. This is computer imaging. It can never give you the right exact picture.
Absolutely.
But at least you get a direction that if I shorten this, ऐसा दिखेगा.
How would I look like?
Tip narrow किया तो ऐसा दिखे. So they get a good idea of that. So yes, technology helps there. We are using now minimally invasive techniques. There also that is because technology. Now we use scopes, thin tubes through which we can see. The instruments have become more and more evolved.
Right.
We can do things better now.
With minimal stuff.
Yes, I am sure, 110% sure in another 5 years, robots will be there doing some of our work for us.
Right.
Hopefully not all the work, because I don't want to retire so soon. See, one good thing about robotics and all these things. Medicine में, like we talked about blaming, robots can't take the blame.
Right.
तो blame लेने को तो हमको उधर होना ही
है, right.
तो basically
you need a human.
Yes. तो
Take the blame.
supervisory role में तो लगे.
Right.
But what I know for sure is that in 10 to 15 years, the medical scenario will not be what we have grown up with. It will be a far different scenario.
Absolutely.
It will be more dependent on technology.
What is your perspective on cultural beliefs with beauty?
So this is one of my, we do some teaching.
Right.
I also try to train junior plastic surgeons and what we call residents,
Of course.
Doctors learning plastic surgery will come to us for some training.
Right.
One of the things I always emphasize, and what I told you just now, that cosmetic surgery doesn't exist in a cultural vacuum. See, the needs of a man or a woman in the US and his expectations from a cosmetic perspective, from how he looks, are different.
Absolutely.
His clothes that they wear are different. Their habits are different. The things that they do are different. From a person, let us say, in South America, Brazil, Argentina, or in Lebanon, or in Iran, and similarly in India.
Right.
I always give them my favorite example. When we started, we used to, now if I'm doing a tummy tuck, we used to do a standard procedure which was described in the books and which our seniors taught us. And that procedure was developed obviously by surgeons in the West. Now, as I started coming into and handling patients myself, the problem was that the way they handle their tummy tucks, you see, they are not much bothered about how the navel looks after a tummy tuck.
Okay.
And I was never happy with the navel, the way it looked after a tummy tuck, the way they perform it. But then I realized, see, if you go to the West, you see, in most of their formal dresses, okay, they do not display the navel.
True, they don't.
Even if it's let's say it's a wedding, everybody's wearing, it could be a short skirt.
Yes.
But the navel is not displayed.
That's true.
Okay. Now what happens in India? We wear saris a lot.
Absolutely.
Most of the time it's a sari.
Yes, absolutely.
Now I don't know about a Bengali sari, but with the way it is worn in the western part of the country,
right,
the navel gets displayed.
Absolutely.
So after the initial few times, my women patients used to sometimes complain about it. Sir, मैं साड़ी पहनती हूँ ना तो ये मुझे अच्छा नहीं लगता है.
Right.
ये थोड़ा अलग लग रहा है. So then I actually sat down and I developed my own technique of doing this, whereby now the navel is looking so much more better that now when they come for a concert, I proudly tell them कि मैं तो तुमको नेवल दूंगा ना तो तुम साड़ी नेवल के नीचे 4 इंच
पहनोगे. Right.
So there are cultural differences,
and that will change the expectations.
That changes expectations. Women in the West, when they do breast augmentations, frequently choose implants which are they called teardrop because the implant is slightly flatter on the top and then it comes out in the bottom, so it's like a teardrop.
Right.
Not here. If I use a teardrop implant,
they will not like it.
99% of my breast augmentation patients will not like it.
Right.
They don't want it flatter on the top.
Right.
They want more cleavage on the top.
Absolutely.
So we go for a round implant. So there are these cultural differences. Europe, especially the teardrop implant is very commonly used. They are surprised when they come here. The cosmetic surgeons from abroad, they come here from Europe, especially France. They come here and say, you use these they are abnormal looking.
Right.
They are abnormal looking to
For
you.
you, yeah, exactly.
For
Our
my-
perceptions of beauty are different. So expectations obviously will be different.
So culture
does play a
huge role.
Right. So, now we have spoken about the culture. Now, suppose I decide to go to a surgeon for surgery, some kind of whatever. What kind of things should I look out for in that surgeon? What is the qualification? What is the experience level? Or what are the kind of red flags I should avoid?
This is a very important thing for every person because, like I said, this is a life-changing surgery.
Absolutely.
Things going wrong is not something that you like to do.
Right.
Not that they can't go wrong in the best of hands, but the chances are that it will
Much lesser.
Much less. So I would say these few things. First of all, look at the qualification of the doctor.
Right.
Every doctor has to put up his qualification. It's a legal necessity.
Right.
कि तुमको आपका qualification जो है वो patient के सामने waiting room में जिधर भी है तुमको लगा.
You have to display.
Yeah.
Right.
Acha, in India, it is primarily plastic surgeons who will do cosmetic surgeries.
Right.
And there are 2 degrees that qualifies us to be plastic surgeons. One, which is the best one, and that is called an MCH. MCH is the degree in plastic surgery, of course, which is what they should look for.
Right.
Number 1. And number 2, there's another degree called a DNB. That is also an alternative degree. So at least DNB तो होना चाहिए, preferably MCH रहेंगे तो और भी अच्छा है. So qualification is important.
Yes.
Secondly, I would say look at the experience of that doctor. In the sense, it's on. Every doctor will have his website. They will show their qualifications, so you can get a idea of how long this. Not that junior plastic surgeons can't do a job. Right. But then experience always teaches you. I also been a junior surgeon and I worked under other people before I started on my own. Absolutely. So yes, experience does teach you. Avoid doctors who do a lot of social media too much. Social media is now, so it's an essential thing, and every doctor is going to show his he'll trying to popularize himself. But too much of it. Probably, I'll tell you why it's not a good idea. Because social media means you have to spend on social media. Right. Number 1. Now, when you spend on social media, you have to also make an effort to recover that money.
Recover that cost, absolutely.
How do you recover? I mean, at stage comes when you start doing things which you should not, just to recover that money. So, too much of social media, I would say avoid. Secondly, now other thing I'll tell you, look at the before and after pictures, but be careful because it is so easy to manipulate before and after pictures. And I know for certain that this is a manipulated image. Absolutely. You can't trust pictures now. The best way to do it, is to visit, I would say consult minimum 2 and preferably 3 to 4. You will end up spending a little bit more. But when you talk to 3-4 surgeons, you get a much better idea. Absolutely. And the surgeon should spend time with you. You go to a surgeon or you tell him कि मैं हो जाएगा, don't worry, 5 minutes तुमको सब test लिख के दिया surgery. That's not correct. That's what? Any cosmetic initial consultation which gets done inside of 20 minutes is a no-no. Avoid that surgeon. That surgeon has to sit down, explain the procedure, explain complications, explain sequelae, what can happen, what cannot happen, what should you do, what should you not do. And if that doctor is finishing everything in 15 minutes and is agreeing to whatever you're saying, please don't go to that person. There are complications associated with every procedure, and it is the duty of that doctor to explain to you what can happen. Let us say you go alone to a surgeon and he says, कल आ जाओ मैं कर दूंगा. Don't go. Please go to a surgeon who asks you to have a companion with you better. Right. Initially you can go alone maybe and you get an idea. But then next time when you go, please take somebody with you, or at least the doctor should ask you किसी और को भी लेके आओ साथ में. Because then you have corroboration of what I have told you, what you have understood. You can discuss with that person. Right. So I think these are the things. Get a judgment of doctor who you feel. Your mind will tell you. Yes, you visit 3-4 surgeons. You get a good idea. You get an idea. So I think that's the best way to to go to.
And don't jump into doing something like
Never jump.
Yeah.
And yes, never jump. Actually, there are some clinics, which will follow you. In the sense, you online, you click on their form or something, and then the next day onwards, you will start getting calls from that clinic.
Right.
They will promise you this, they will promise you that. अच्छा एक बार नहीं कॉल आएगा, दो बार नहीं आएगा, 50 बार आएगा.
Absolutely.
Avoid these clinics.
So you were talking about non-surgical procedures, no? So in these kind of procedures or any other, so even surgical also, I mean, are there any lifestyle factors which you advise the patients to follow after a procedure so that the effect remains for a longer time?
Some things, yes, but one thing about non-surgical procedures, their results are usually of a lesser duration than a surgical.
Obviously.
Okay. For example, like I told you about Botox, the effects last 4 months,
right?
5 months.
But what happens if I smoke and drink a lot after that? So that
smoking is a bad thing for anything. And a surgery procedure, though smoking is very bad, it increases your complication rates by 5 times. So if I get a patient who smokes, I tell them to eliminate or cut down smoking dramatically for at least 1 month before the procedure.
Okay, Kiran. So what happens is you have been doing surgeries for so many years. Can you come up, give us some stories where, after you have done the surgery on them, I mean, the patient's life has completely changed. The patient was extremely happy, or some kind of miracles which you feel you yourself are very satisfied with it.
Not miracles. Of course, you get a lot of patients who will be particularly happy with you, and whenever you see a good result, of course, it's a thrill. It's a kick. It's a high.
Absolutely.
But as far as procedure-wise, what I have found that women who have undergone breast augmentation procedures, they are some of the most satisfied patients that I have had.
Because breast is a part of identity of being a woman.
Yes, absolutely. We call it a marker of femininity.
Femininity, right.
It's something which makes a breast in some women, not all the time, but in a lot of
women actually.
The breasts are a sense of, being a woman is, being a complete woman.
Right.
And the second thing is, now I do a lot of transgender patients.
Right.
Because, for me, transgender is one extreme end of the same spectrum.
Right.
There will be some patients who are not happy with the nose. There will be some not happy with breast, tummy, whatever. Here, that patient is not happy with the whole body only.
Right.
Inside, it is a woman or a man, and the body is something. So they want everything changed.
Right.
Correct. So it's a variation, and I do a number of transgenders also. But they undergo not 1, not 2, sometimes 4 surgeries, sometimes 6 surgeries. But when everything is done,
right,
they are thrilled. When everything goes well, which usually happens,
right,
they are very, very happy. I have had patients who have told me, you have given me a new life.
But a complete new identity is formed.
But something which they were wanting so desperately.
Right.
And they were so uncomfortable in that body. So the motivation for that is massive. One thing is, the more the motivation, the more happier the patient after the procedure.
Of course.
So that is one of the things I always tell, because you asked me this question, what the patient should
ask themselves before.
Yes. So one of the things I always tell my patients is, if this issue troubles you every time you look into the mirror, then probably you should be thinking about it. But if this issue only troubles you when, let us say, you are going for a party once in 3 months,
right,
troubling you very occasionally, otherwise you are going through your morning, you get up, you go, you do your stuff, and it doesn't affect you the whole day, then please don't do it.
I just feel like doing that's a want, but it's affecting me as a person, then that becomes a need.
Yes.
Right, Kiran. Now we have spoken a lot about, what is plastic surgery, and so now let's have some fun. Okay. So I'm going to ask you some rapid fire questions. And
hamper मिलेगा hamper.
Hamper मिलेगा, of course मिलेगा. मेरे साथ बैठ के बात करने का hamper मिलेगा. What would you like to do more? Like, go for a long drive or curl up with a book? What makes you relax better?
110.
110% book. Oh, really?
Bombay में you have to driven. Long drive is like 500 meters. बहुत long हो जाता है.
So tell me, Kiran, who has it easier, men or women?
Women. They have men to support them.
Men, women to take care of them. Not
Okay, honestly, man, I totally agree. Like, I mean, I cannot imagine, the things that my wife does, which I'm sure all wives do,
Right.
all women do,
Right.
not only wives. She looks after the home.
Mm-hmm.
She looks after the cooking. She looks after the shopping.
Mm.
She looks after the children.
Mm.
She manages the whole. I mean, we have a hospital, so she looks after all that. You name it. Actually, bearing children.
Best multitaskers.
Multitaskers, definitely. Nurturing and giving birth, giving life,
Absolutely.
I think is incredible. So yes, men is definitely easier. Easily. Next generation, I want to be a man.
Man only? Okay. So, what do you feel is the good, what do you expect qualities in a good friend?
Loyalty.
Loyalty.
Loyalty and a willingness to, I think that's what ultimately a friend is when you call somebody a friend. Somebody who will come to your aid, who will not judge you,
Mm-hmm.
and who has a certain amount of loyalty towards you.
You said you like to read books, right? So, who's your favorite author?
My favorite author is now I won't you can't even call him an author actually. You heard of Bill Watterson? Okay, Bill Watterson is the person who has created and the Calvin and Hobbes.
Right.
He's ultimate, my favorite. In fact, whenever I am going through anything which I am not happy with, I have the full collection.
Oh.
Calvin and Hobbes, the full collection, and I was when it was released, the full collection was released, and I was probably amongst the first 10 persons to have it in Mumbai for certain. Baki, I like simple, proper detective, must Agatha Christie. Oh, P.G. Wodehouse is a
P.G.
favorite.
Wodehouse,
Yes,
yeah.
big favorite.
I'm
I have read Shakespeare.
Why didn't you go into English literature and why did you come to medicine?
And I still do. But when we were growing up, if you were decently good in your school and all that, तो तुमको दो ही option थे, doctor बनो या engineer.
Engineer कर लो.
And my dad said, family में कोई doctor नहीं है, तो.
So you're the first gen doc in your
Oh
family.
yeah, first gen. Me and Supriya both. Nobody has been doctors.
So thank you, Kiran. It was great having you here today, and we had a lovely discussion. Thank you for coming to the Health Talk. I'm sure my viewers have got a much better perspective of what a cosmetic surgery is, why they should go for it if they want it, and how they should choose their surgeons, how they can think about realistic expectations. It was a great conversation. Thank you so much for coming.
My pleasure. It was really nice. It was so fun. It was great to meet up with you again and to talk about all these things. It is always a pleasure to be with you.
Thank you.
Thanks a lot.
Thank you. Thank you for tuning into today's episode. If you enjoyed the conversation and found it helpful, be sure to subscribe to The Health Talk with Dr. Sagorika Mullick for more such insightful discussions. You can follow us on Instagram, and remember, you can also catch this episode and more on Spotify or your favorite podcast app. The links are provided in the description. We would love to hear from you, as your feedback will help us to bring you the topics that matter most to you and your family. So until next time, stay informed and stay healthy, one episode at a time. And don't forget to like, subscribe and share this episode. Your health journey starts here.